Folks, good afternoon. Paige Smith here with NASCAR Network News. We're in beautiful downtown Philadelphia as part of the DNC convention. We're joined here with one of the largest caucuses to attend the convention, the Mental Health and Substance Use Reform Group. And they're here today in Philadelphia to really champion the cause of what needs to be done in dealing with mental health and substance use throughout the United States. We're going to be hearing many dignitaries speak, Patrick Kennedy to the mayor of Boston, and many, many others who are championing this cause nationally. Why is mental health and substance use, from a medical perspective, treated differently than cancer or any other medical issue that we would go into the ER for?
Consuming and frustrating to get an appointment with a mental health care provider. Networks can be stale or wrong. There can be limited coverage for brand name drugs. This is a very complicated problem. Corporations have big wallets because they buy health care en masse. And again, I'm so glad that Patrick is taking this up because it's very important.
So we thank each and every one of you. You are all heroes, but heroes need help. And here we are at the Democratic Convention. Donald Trump is saying he wants to build a wall for $20 billion in order to keep drugs from Mexico out of the United States. But he does not say that he supports $1 billion in order to provide the treatments, the beds, in order to ensure that we give the help to families who need it right now.
Guys, hi, Paige Smith here with NASCAR Network News. We're here with Mr. Patrick Kennedy. Welcome.
Thank you, Paige.
We're talking about a very important issue today, substance abuse, mental health abuse. Mr. Kennedy, tell us, this is a passion of yours. Talk to us about the history of why you're such a champion for this cause.
Well, first of all, I'm a person in long-term recovery. That means I haven't had drugs or alcohol since February 22nd, 2011. I am also, ironically, the sponsor of legislation that would guarantee that anybody suffering from an addiction or mental illness actually gets the coverage that they need to survive and, these deadly illnesses. And what I'm working on today is to try to advocate for the implementation of that law, because it's not enough to have a law, you actually need to see it enforced. So we're working to make sure that people aren't discriminated against because their illness is an illness of the brain. No one wakes up every day and thinks about how they can alienate everyone around them, how they can steal, lie, jeopardize their job, jeopardize their relationship with their family. No one chooses that life. And there is treatment, and treatment works. What we now need to do is get that treatment paid for, and that's what the Mental Health Parity and Addiction Equity Act requires under law, that insurance companies, both the federal government as well as private insurance, reimburse for addiction treatment and mental illness treatment.
Now, you're sponsoring or attempting to sponsor funding to really fight and champion this cause. When you talk about mental health, often in the minority communities, this is a taboo subject. How can minority communities tap into the resources so that they too can be well served when it comes to treating these illnesses?
Well, we need cultural competence. We need to have providers look like the community that they're serving, for one, and that unfortunately does not exist in the mental health community by and large. You don't see the faces of color in the mental health provider community, which would encourage people to feel like they understand where I come from, what I'm dealing with, I can share with this person. You also have an environment where the shame around these illnesses is still very pervasive. But the ecumenical community is really stepping up because they know that the silence, which is born out of a sense that this is a moral failing, that has to be shattered. And that if we do that, people thrive and survive. And it's a very spiritual movement to help people regain their lives, their families, their futures if they get the treatment. And that means not only the medical treatment, but to address the historical inequities, particularly the minority community, towards access to housing and employment and, to survive the kind of very brutal kind of environments that many people in the minority community end up growing up in because of the historical racism that pervades our system in a very insidious way and communicates itself, which itself can be very stressful and lead to very challenging mental health problems that anyone would suffer from if they came from the environments that many people of color come from, simply because of the historical racism that is in our system.
How can people learn? Where can people get information? How can people learn more about your efforts, as well as here in Philadelphia and other places around the country, where they can get access to treatment and get the information so they can make a difference in their lives?
They just need to look up Kennedy. It's the www.thekennedyforum.org. Just Google Kennedy Mental Health. They'll get everything they need. We're partnering with Morehouse School of Medicine. David Satcher is my partner in all of this. Scattergood here in Philadelphia. Arthur Evans and the great work he's doing here in Philadelphia. I mean, we're really building a coalition, and this is like a campaign. And we intend to win in this campaign because there's too many people whose lives are counting on it.